People's lives are at stake, and the response so far has been unacceptable.
Anxiety over the Ebola virus that continues to grow in the U.S.
This as questions remain over how 2 nurses managed to contract the disease while treating an infected patient. South Carolina is one of several states speaking out to calm the public's concerns and fears over the spread of the Ebola virus. Today, the state's health department held a news conference to address some of the questions.
DHEC officials say their statewide trauma network is ready to handle the possibility of an arrival of an Ebola patient. Now, News 13's Evan Donovan joins us live from our Greenville News Center with more. And Evan, what are officials doing to be prepared?
Well, DHEC says that the Medical University of South Carolina in Charleston has doctors and nurses that have volunteered to care for Ebola patients and that they are trained and equipped to handle those cases when and if they do begin. Concerns are growing over how well U.S. hospitals are trained and equipped to handle Ebola.
The dangers of you contracting Ebola, the dangers of a serious outbreak are extraordinarily low.
Especially after the second case in the U.S. turned out to be a nurse at Texas Presbyterian Hospital who treated the first patient.
Don't mistake, we are having those conversations.
South Carolina health officials say they're addressing those concerns with a statewide emergency communications network that includes responders from firefighters to doctors.
We are going to see more cases in the United States, but we are going to do everything we can to contain those cases. We are not West Africa. We have this. We have a robust, trained emergency management system that can really work to contain this.
This isolation unit will transport Ebola patients to MUSC in Charleston, which has agreed to provide ongoing care. DHEC also has a trauma network that includes hospitals from the upstate, and it expects them to come on board in the next 24 to 48 hours. Spartanburg Regional says they're prepared.
Hospitals like ours are well prepared to deal with infectious disease outbreaks. And quite frankly, we deal with outbreaks like flu almost every year. So we do things like this on a regular basis. We're ready for it.
DHEC says they're working with U.S. Customs to identify anyone who travels into South Carolina from West Africa. But they noted there are no direct flights, so following that paper trail is proving difficult. DHEC Director Catherine Templeton says to remember 3 things when dealing with Ebola patients: identify, isolate, and communicate. Identify someone who is exhibiting the symptoms like a high fever or abdominal pain. Isolate that patient and communicate immediately with DHEC so that they are aware that there's a possible Ebola case. Reporting in the Greenville News Center, I'm Evan Donovan for News 13.